We have with us Dr. Mohsen Asadi-Lari, Acting Minister for International Affairs from Iran. And we cannot talk about primary health care without remembering Iran. Welcome to the program.
Thank you very much, Dr. Ibrahim.
Primary health care and universal health coverage. Where do we stand in Iran? Is there hope everywhere, even in the most remote areas, to get to that goal?
Bismillah ar-Rahman ar-Rahim. As you know, in Iran, actually, we have a strong primary healthcare system, starting back to 35 years ago, established actually in after the revolution. Actually, we had some pilot studies before the revolution, for example, for 45 years ago. But after that, actually, we have a strong disseminated system, including remote areas. Actually, it started in very remote areas. And now we are so happy that
it's all over.
Nearly 100%.
I have a question there, because in many countries they started with primary health care, and then, you know, tertiary care sort of becomes important as well. How has Iran managed to sustain primary health care as a priority?
Yes, that's true, actually. But you know, primary health care starts with primary care until tertiary care. So it's important to have a continuous care actually for this. But Iran, during the last 4 years, we have a strong transformation plan in Iran, started by Rouhani, President Rouhani administration. Now we are so happy that the tertiary care and secondary care has been more attended, and now more than 24,000 hospital beds were built, and especially in remote areas. But the most important thing is we have not forgot the primary health care.
Essential.
Yes, the essential is primary health care.
And primary health care used to have mainly communicable diseases, but recently have you also introduced all the elements of non-communicable diseases as well?
Exactly, this is very much true. Actually, the most important killers of the population is NCDs. More than 70% of the death toll actually is from NCDs. We have a very good established national NCD plan in the country since 2015, launched by DG, Margaret Chan actually at that time. We have continued for 13 targets actually for NCDs. Four more than the global target.
Nothing happens without partnership. So how are you, intersectoral collaboration, how is that coming along in Iran among all the agencies?
That's a very, very good point actually, that you know, one of the main components of PHC was intersectoral collaboration and community participation. We fortunately established a national council for health and food security, chaired by the president himself, and 9 ministers.
The president himself was there?
Yes. And
so it's the highest priority.
Exactly, and 9 ministers are there. Intersectoral collaboration starts in that level and continue in the very remote areas, very low-level grassroots areas.
You seem to have it all in order. What is your biggest challenge?
Actually, the biggest challenge would be the NCDs, and after that, the sustainability of the resources. The sustainability is very much important. And we have, you know, like other countries actually, we have some normal resources and some additional resources. For example, tax on tobacco. It's very important to have.
Many people are complaining probably in the streets, right?
Yes, that's true.
That happens.
And fortunately, we have some progress in that regard, but you know,
it's always difficult. It is one of the biggest challenges.
Exactly.
And also now we know that the next regional committee is going to be in Tehran.
Yes, that's
congratulations.
True. We are so happy actually to welcome you again. It's the 3rd time actually being in Iran, and I'm very happy actually that you attended in Isfahan.
Islamabad.
You attended in Isfahan actually.
It was lovely. Isfahan is such a beautiful city actually.
Thank you. It's part of the half of the world actually. But you know, next time we'll be in Tehran, and I'm very fortunate and very happy actually that yesterday all the ministers and the delegates agreed on the date as well. So it will be in Tehran. We are so happy actually to welcome all ministers and all delegations from the region and beyond the region actually to attend.
Thank you for being with us.
Thank you very much.
Health for all, by all.
By all. Thank you.